Okay, so let's take a look at the patient harness that we have in our kits. We've got this patient harness that lives in this blue stuff sack here, and we'll take it out and show you what it looks like, and then we can look at applying it to a patient. The stuff sack actually stays sewed to the harness so we don't lose it. And then I've got this harness here that's got a waist strap, and it has these buckles that are quick connect, so I can apply them to a patient without having to shimmy these up and down their legs or around their waist. Same thing with the leg here. These quickly attachable and quickly adjustable leg loops as well. Their belay loop is this single piece here. Let's look at putting this on a patient. All right, so we can look at applying this harness to a patient. I can apply this harness to a patient that's standing or sitting or laying, or even somebody that's kind of precariously perched somewhere on the side of a cliff if I'm going to do a pick-off. It's one of the advantages of these quick buckles here. But we'll look at a laying patient. That happens quite often. So I want to figure out my orientation of this thing first, and then I'll usually open these buckles up quite a bit, and then I can feed these through my patient's voids, leaving them in line as best as possible and disturbing them as little as possible. Get the waist belt part there on and centered. Get that all figured. And then these leg loops, again, using my patient's voids as best I can. Disturb them as little as possible. Leg loop right there. And then my second leg loop. Same thing, you can see as I'm applying this is pretty easy to apply without moving my patient around very much, which is helpful if I have musculoskeletal or spinal injuries. There we go, and then I've got a belay loop right there, ready to go.